Hello and welcome. If your child's doctor has mentioned a cardiac stress test, it is completely natural to feel a little bit of concern, to have a ton of questions. So today we're going to pull back the curtain on this whole process and really turn that uncertainty into understanding. Okay, let's dive right in.
And really, this is the big question, isn't it? Whether it's during a soccer game, playing in the park, or just running around the house, you just want to know that your child's heart is safe. And that is exactly what this test is designed to figure out.
So, here's what we're going to cover today. Think of it as our game plan. We'll start with the basics, what a stress test even is. Then, we'll get into why a doctor might recommend one in the first place. After that, I'll walk you through the entire procedure, step by step, so you know exactly what to expect. We'll talk about what happens after the test ends, and we'll wrap it all up by talking about why having safe, supportive care is so important.
So, first things first, what are we actually talking about when we say stress test? Let's break it down into simple terms.
Okay, at its core, it's basically a safe, supervised walk or jog on a treadmill. The two most important words on this screen are controlled and monitored. See, some heart issues only show up when the heart is working a little harder, so this test gives doctors a chance to see how the heart performs during activity. It's completely non-invasive, and it's always adjusted for your child's age and their fitness level.
So, what are the specialists actually looking for during this? Well, they're watching for things like changes in heart rhythm or blood pressure. But, and this is key, they're also connecting that data to the very symptoms you might have noticed at home, things like chest pain or feeling dizzy during play. They even look at how well the heart bounces back after the exercise is over. It's a really complete picture.
That leads us right to our next question, which is probably on your mind. Why would a doctor recommend this test for my child?
Well, there are a few common reasons. Sometimes it's to get to the bottom of specific symptoms, like that chest pain or fainting during activity we mentioned. Other times, it's more of a proactive check-in, maybe to monitor a condition they already know about or to make sure it's safe for your child to play sports. It can also be a way to check on how things are going after a surgery or another treatment. And this is just so crucial to understand. A stress test gives us a unique window that we just can't get otherwise. An evaluation done while your child is resting and calm is incredibly important, don't get me wrong. But it doesn't tell the whole story. It doesn't show how the heart really works under pressure. This test, it fills in those critical gaps. All right, let's get into the nitty-gritty of the test itself. I find that knowing exactly what to expect, step by step, can make the whole thing feel a lot less intimidating for both you and your child.
The whole process is actually pretty straightforward. First, the team will gently place some sticky ECG electrodes and a blood pressure cuff on your child, and they'll explain everything they're doing as they go. Then it's time for the treadmill, starting off at a really slow, easy walking pace. The speed and incline will go up a little bit over time, but it's always based on what your child can comfortably do. This is not about pushing them to their absolute limit. And the most important part is that the medical team is right there the whole time, watching everything closely.
And you should know, the actual exercise part isn't some huge marathon. We're usually talking about just 10 to 20 minutes of activity. It's a short, really focused evaluation to get the information they need.
And I really want to hammer this point home. Your child's safety and comfort are absolutely the #1 priority. A trained pediatric cardiologist is supervising the entire time, and if your child feels uncomfortable at all, or if the team sees anything that concerns them, the test stops immediately. Your child is in control.
Okay, now for a super practical question that I know is on every parent's mind. What in the world is the dress code for a cardiac stress test?
It's really simple. Think gym class. Comfortable, loose-fitting clothes and a good pair of sneakers are absolutely perfect. Also, it's a good idea for your child to avoid a big, heavy meal right before the test. A light snack is fine, but you want them to feel as comfortable as possible.
All right, the treadmill part is over. So what happens next? Let's talk about the recovery period, because this part is just as important for building that complete picture of your child's heart health.
So after the exercise is done, there's a little cool-down period, but the monitoring doesn't stop just because the treadmill did. The team keeps a close eye on how quickly your child's heart rate and rhythm come back down to their normal resting state. This recovery data, believe it or not, is another vital piece of the puzzle.
And of course, the big question once the test is all done, when do we get the answers? When do we find out the results?
The good news is you won't be left waiting and worrying for weeks. A pediatric cardiologist will analyze all the data from the test, and they'll typically go over everything with you in just a day or two.
Okay, finally, let's talk about something that's incredibly important.
Why doing this in a specialized pediatric environment makes such a huge difference?
You know, having this test done at a center that focuses on kids is a real game changer. The protocols they use aren't just adult tests made smaller. They're designed specifically for a child's unique body and heart. The whole environment is led by experienced pediatric cardiologists, and just as important, the staff knows how to talk to kids. They explain each step in a friendly way that builds trust, not fear. It's really a whole-person approach to their care.
So, what's the big takeaway from all of this? A pediatric stress test isn't something to be afraid of. It's actually a powerful tool that gives you clarity. The whole goal is to provide you with clear, reliable information so that you can make confident decisions, ensuring your child can live a safe, active, and wonderfully healthy life.